Welcome to this online courses about treatment using virtual reality, which means virtual reality exposure therapy. Today we'll talk about different kind of psychotherapeutic methods for you to treat your patient in virtual reality. As you may know, you can't use virtual reality directly. You have to beforehand teach your patient different techniques related to behavioral cognitive therapy. Today we'll talk about self-affirmation, how your patient can assert themselves when they want to say no, when they want to express their needs, their requirements, when they want to express their ideas or their point of view. You will have usually two kinds of patients who will need this kind of treatment, who will need this kind of techniques. It will be mostly social phobic, so with social phobia. The problem with social phobia is that they suffer from the fear of being misjudged by other people. Like, I'm afraid that they will think I'm stupid, I'm ugly, I'm not competent, I have no skills. Usually these thoughts are not real, they are irrational, but still it produces suffering. And they do not try to assert themselves, to assert their point of view, and they suffer from it. That's why they need your help with these techniques. The other kind of patient that will need also self-affirmation is your patient suffering from addiction, smoking, taking other kind of drugs, heroin, cocaine, cannabis, etc. They will need also these techniques because they will need to know how to say no, and then to assert their point of view. Because if they don't dare to say no, then there will be a real risk of relapse. So now we'll start with these self-affirmation techniques. I will now talk about how to communicate. Your patient will need the techniques in order to communicate, even if they feel stressed. But if they know how to communicate, then they can express correctly their desire, their ideas, their point of view. Regarding communication techniques, you have two kinds of communication techniques. You have the verbal techniques and the non-verbal techniques. Let's start with the non-verbal techniques. So it's just, you just ask your patient to use their facial expression, their body expression, etc. So, because not only word is efficient in a dialogue, but also the gesture. We'll start with the hand gesture. First of all, your patient, you need to teach your patient to use their hand, like Italians, yes, to communicate and to assert themselves. When hands accompany the idea, accompany the thoughts, it's easier to express them. So you really have to train your patient in virtual reality, but also when they are at their home, ask them to train, even in front of a mirror, to use their hand when they communicate. The other important part is regarding the rhythm of a voice. So not the discourse itself, not the content of the idea, but the voice itself. A voice must be slightly slow. When there are certain point of view, they should not talk too fast, and also not in a top pitch voice, like they are going hysterical. No, they have to talk in a very casual way, slightly slowly, to express their point of view. Now the other part is regarding the body, the body movement. It's important that the body also express communication, express their idea. So when they communicate, your patient have to stay almost this way, straight, but not stiff, but straight, not curved like this, or bent, not bent, but really straight. Same thing when they are sit down in front of someone and they start talking during an interview, for example. Same thing is the distance between speakers. It's good to maintain a certain distance. If they are too close, if your patient is too close from the speaker, or someone they want to speak with, then it will be see as aggressive. So it should be avoided. And at the same time, if they are too far, it seems a little bit cold. That's the reason why it's better to stay between 1 and 2 meters. You have to say that to them. Now what about, so we talk about the hand, the body, but what about the face? You have to tell your patient that they also used to mimic, to use movement in the facial expression, to express joy or sadness. So using the eyebrow, the cheeks, and the lips. So when they hear a sad news, they have to express sadness. And when they talk about a joke, when your patient hear a joke, they have to smile or to laugh. They have to have an open face. It will be better for communication. Now, what about visual contact? What about the eyes? It's better if your patient, of course, look at the people talking to them. So they have to look in the eyes, but not look like piercing their head. Just look in a casual way, which means look in the eyes of the speakers almost 80 to 90% of the time. Now, with all these techniques, the non-verbal techniques, it's a first good way for them to assert themselves, no matter what kind of topic they want to bring about. Now, what about the verbal expression? So, how to say things? That's another kind of communication techniques that you have to teach to your patient. Once again, they can use it in virtual reality with you because they could train themselves in front of a virtual audience using the C2K environments. So when your patients are in a gathering, in a party, or in a meeting, in a professional meeting, or in classes, if your patients are students, then they have to use these techniques, the following techniques. First, your patient have to be curious. In a conversation, it's good to be curious, to ask questions. So, and show interest. Oh, you like cars. Oh, okay. You like clothes. You like arts. You like architecture. You like soccer. And then express the interest. Oh, what is your favorite team? And what is your favorite cars, etc. So they have to show they are curious regarding the people with whom they speak. Because it creates a warm feeling and it's good for conversation. The other part is the other idea, so it was the first, be curious, and the second is to know how to listen. Because in a conversation, if you don't listen, then you can't follow the conversation. And as you know, the social phobics have an issue regarding introducing topics or maintaining a conversation. But before maintaining a conversation, it's good to hear, to listen to what the speaker have to say, what the people have to say. So we need to have an active listening to really hear what the topic is about before expressing their point of view regarding the topic. Now, 3, it's good that your patients observe the others and also express compliments. But to express compliment to someone, you first have to observe her or him. How is he dressed? What kind of watch does he wear? What kind of necklace does she wear? And then use this to express a compliment. So your patient have to express compliment. And they should not express lies. The goal is not to lie to someone, "Ah, you're very beautiful." Saying that to an ugly person is not useful. But they have to express exactly what they think and express a sincere compliment. So by observing, so yes, oh, you have a very nice watch. Oh, you're very elegant. Well, you choose well your necklace. It's very nice. Oh, I like your makeup. It's nice. It's beautiful. It suits you very well. You see, when patients are doing this, it's good for the ego, of course, of the other person, and then this person will be usually more kind and will more listen to your patient. It will be easier to assert themselves. Now, what about the other part? So 1, 2, 3, 4. So to smile and to laugh. In a conversation, you have to train your patient to smile when there is a warm conversation, because it's a convey positive feelings towards the other people, and it's easier to communicate this way. So it's good that your patient do not have a stiff expression, like very stressed and very stiff, but smile when he's talking about interesting topics or funny topics. Once again, your patient can train themselves with virtual reality under your supervision, and you can check if they indeed are applying all these techniques. And of course, they can also laugh if your patient hears something funny, a joke, or anything of this sort. It's nice if they can express laugh. Okay, now let's talk about concessions, or 5 concessions. If there is, we'll see more of that in the conflict chapter, but if there is any conflict, if your patient feel that in the conversation they can't convince someone about their point of view, then they should conceive, they should express that they are not right, or maybe the person have another point of view. They should express, in fact, that they respect their point of view. Okay, I do not agree with what you say regarding traveling to the moon. We don't have the same point of view, but I respect your point of view and I really understand it. You see, it's a good thing because you concede that the other deserve your respect. And this is something that you should say to your patient as well, because there is different aspect of this. Is you have to teach your patient that they deserve respect, in fact, and respect is very important. Everybody deserves respect, so your patient also deserves respect. It means that if they feel that someone do not give them respect, they should not also give respect to this person. They should value, because they should understand that everyone has the same value. So your social phobic patient or your addict patient must understand that everyone have also value, and so the others should value their point of view and should value what they have to say. Anyway, so let's go back to concession. So it's always better if they concede that yes, we don't have the same point of view, etc. But the question that often your patient will ask you is, okay, I got these principles, but now how can I introduce a new topic, because I do not dare introduce a topic. I don't know what to say. In fact, I don't know what to say in a party, or I'm always feel stressed, and even if I practice relaxation, then you should say to your patient that beforehand, before a party, before a meeting, before going to classes, they should look on internet for news, because news is an excellent source of topics for a conversation. So your patient should beforehand look at news. So what kind of news? Usually, ideally, funny news. So they can introduce a topic with a funny news, and it's always bringing warm in the conversation, warm feeling. So funny news. It's nice also to look at science news, because it shows when your patient talk about science, what's going on in the universe or in the society. It shows that they are open-minded, and it could also draw interest, draw attention to them. And also, it would be nice to look at international news, because it shows to your patient, to show to the others, your patient show to the others that they are open-minded. And it's always interesting to know what's going on in other countries, in Japan, Australia, in Europe, in USA, in North Pole, South Pole, everywhere. It's always draw attention as well, and interest. So it's good to, beforehand, they look at this news, and when they say look, I mean really read the news. Almost, maybe the first time, it would be nice if your patient can learn it almost by heart. Because often in the situation, in the party or in the class, they will be very shy, or they will be very stressed, and they will not remember, oh, what was the news I would like to use, I forgot. So it's better if they learn it by heart, and they train with you to express it, for example, while wearing the headset in virtual reality. So it's difficult, they just have to read several articles. But the question is, now that they know the articles, they know the topic, how to introduce the topic. They should not say directly, okay, I've seen that Elon Musk is planning to travel to Mars. And no, that's not efficient. the best is to use a question. So to start a conversation by a question. Let's take again this example. Have you seen what was happening with this car in space? You see, it's better because you have people with your patient who say, what car in space? And then your patient can really start the topic. So always ask your patient to start with a question. Of course, your patient will answer, yes, in space there was Elon Musk, he sent a car in space. Oh, that's incredible, he sent a car in space. And then could maintain a conversation for minutes, maybe even hours. So it's nice to look at the news beforehand. And what about if the question that I'm sometimes asked is, what about if your patient doesn't have any friends? It could happen that we have seen in the hospital some solitary patients. If they don't have any friends, then it's not a problem because thanks to the internet, they can use specific website, for example, Meetup. They can use website to participate to activities and select activities on the net, and then meet in real life this person. So if they are solitary, then you can advise them some website when they can meet friends, new friends. Anyway, so I think that's it for now. Now we'll talk about the other topic in the next chapter.